So the next topic we will be dealing is roles and responsibilities of a nurse. Now, a nurse has diverse roles. She can work in lot of settings. Now, particularly here we are studying the nurse working in MSN, that is medical surgical nursing setting. So they can work here also when we consider in MSN, they can work in wards, that is maybe general wards or private wards. They can also work in the OPD, that is in the outpatient department. Along with that, the nurses can also work in ICU, that is intensive care unit, which is also called as CCU or critical care unit. Then a nurse can also work in the family. So regard all this we will be studying in this portion. What are the roles and responsibilities of nurse in each setting? So first of all, the responsibilities of a nurse in medical surgical setting. A medical surgical nurse particularly works with the adult patients. They can also work with elderly people in the sense here old age people. So when a nurse is working with the old age people, it is referred as geriatric. Okay, so a geriatric care means taking care of elderly people. Most of the time, the nurse has to give continuous care to the patient, that is persistent care. The care which is provided again should be of good quality. And here the patient works not only with the individual but also with the family, or they work with, as a whole we have to consider like a family itself, okay, or a home. So when they are taking care of this individual patients, see that they are providing a supportive environment, okay, see that you are supporting the family also. The next role or responsibility of a nurse is having good communication skills or good IPR skills, so that they will maintain a good mutual relationship with not only the patients but also with the other healthcare team members. And next is a nurse should have good observation. Okay, when they are observing, they should also understand the patient, what the patient is feeling. This is also a major role of a nurse who is working in a medical or surgical wards. Next is the nurse should have in-depth knowledge. They should have good skill or expertise. And why they should have good experience or knowledge or skill is because they have to assess their patients. Not only they have to provide care here, direct care, they should also assess each individual patient. For this, they should have good decision making ability, good judgment ability. And along with that, the major goal of the nurses should be promotion of health and prevention of illness. Okay. And next is whenever you are working in the hospital setting, see that you are having a sort of respect for an individual. You should maintain the dignity of your patients. Okay. And next is helping the scattered family. Most of the time what happens is the patients can have problems because of their families itself. Maybe there are some psychological problems or a certain other problems are there in the family. So what the nurse can do is they can provide with counseling. Next is role of a nurse in OPD. Now in the outpatient department, most of the time the nurses will be assisting the physicians. Other than that, they also have to provide direct care. Now direct care here means the nurse may need to give the treatment that is written by the doctor. Now the doctor will come for their rounds. They will write down what is the treatment, like what drugs have to be given, what injections have to be given and all. So that will be written by the physician. So all this work will be carried by the nurse. Sometimes a doctor will come and write to carry the blood investigation. So what you have to do? You have to go through the chart and you have to collect the blood and send for investigation. Other than that, what they have to do is they have to monitor the vital signs, because patient can collapse at any time, isn't it? So most of the time you have to monitor the vital signs frequently. Next is setting up care plan. Why you have to set up care plan most of the time is, here what happens is most of the time patients will be suffering with certain disease condition. They may have a lot of symptoms. So what you have to do? You have to write the nursing interventions. You have to plan the plan of action has to be written, so that according to priority you are giving care for your patient. Next is the patient may also be having wound. So what you will do when the patient has wound, you have to do the dressing in aseptic technique. Next one is the nurses will also have to do certain other work like collecting the history. Maybe you have to collect present medical history or past medical history. You may, if there is a lady, you may need to collect menstrual history also, or any past or present surgical history. What is your nutritional pattern? Those all things may need to be collected by the nurse. Next is they may have to assist in rehabilitation. It could be physiotherapy or occupational therapy. All this the nurse have to help. Next one is administering IV fluids. Now most of the time if the patient is dehydrated and all, in that case what you have to do, you may have to provide with IV fluids for the patient. Next one is charting. Now we already know we will provide care to the patient. So once you have provided care to your patient, you may have to chart it. Okay, that is recording or reporting is very, very essential. So whatever procedures are carried out, that has to be recorded with date as well as time, or what findings you have seen in the patient, that can be recorded, whatever you have observed. Suppose you went to your patient, when you are giving bed bath to the patient, you might have seen there is skin peeling or skin redness is there. You will have to mention it in your nurse's record. Sponge bath is given, patient is clean and comfortable. Redness is observed. Where it is observed, that also you should write. Whether it is in the scapula, buttocks region, everything has to be written in detail. Okay, and charting, you know why it is essential. Most of the time, proper charting will protect not only the nurse but also the patient. Next one is regarding education. Now, the nurse will have to work like a teacher, and along with that, they will have to give health education not only to the patient but may need to give health education to the family. They may have to teach the patient regarding the disease condition, like what is the anatomy behind it, why it has occurred, how to treat it, what are the symptoms. All this has to be told by the nurse. Along with that, the nurse will have to give health teaching regarding nutrition, how to manage a diet, then how to do pain management or how to recognize the symptoms. And most of the time, the nurses in the OPD, they will have to hold seminars or they will have to hold community meetings. Next is the nurse should have good communication skill. This I need not explain in detail because nurses play like a link between the patient as well as the healthcare team. Next, when you see this picture, what do you observe? You see that one patient is sleeping here. This setting is actually a ICU. It is a intensive care unit. Now, most of the time, patients who are with life-threatening conditions or patients who are critically ill are kept in ICU. It could be patients who are having respiratory problems, cardiac problems. They might have had myocardial infarction or heart attack. They might have had shock or stroke, all these things. Okay, so what you have to do is you have to provide direct care to all these critically ill patients. So most of the time a person who is in the ICU will need continuous care or intensive care. Okay, so the critical care nurse has to be very skillful. They should have good experience and they should be skillful as well. Okay, so what is the role of a nurse in ICU? First of all, you should know that in the ICU there is a team leader or an in charge will be there. Okay, so that in charge will be delegating the responsibilities to all the staff nurses. Okay, so most of the time there may be a ratio of 1 is to 1 where one patient is there, one nurse will take care. Sometimes one nurse will take care of two patients, maybe who are not in the ventilator. Okay, or they are not very much critically ill. So that particular assigned nurse will take care of the patient. They may need to provide total care. Total care in the sense they will have to help with self-care activities like um, sponge bath, maybe bed shampoo, nail care, catheter care, wound dressing has to be done. They have to feed the patient every second hourly, NG tube feeding or IV fluids have to be given to the patient. Along with that, changing the position of the patient, that is also very essential. So all these basic things will be carried by a nurse in the ICU. So if they are, most of the time, if you think of an ICU setting, they will be having lot of monitors. Okay, so continuously you have to monitor this. Maybe a cardiac monitor or infusion pump and see if it is working properly or not. Then next is they may need to also provide advanced life support. A person who is in ICU will have to provide advanced life support. They will have to watch out for any abnormal things like maybe complications or abnormal symptoms are there. Those things has to be checked frequently. And a person may be in ventilator or the patient may be intubated. So what you have to do is you may even have to see if there are secretions. If secretions are there, you may have to do suctioning. Next is you have to perform life-saving activities in the ICU. Most of the time patients can collapse, so you have to provide life-saving activities. And along with that, the patient party here may be very anxious, so you can provide some counseling to the family. Next one is regarding hemodynamic monitoring. Now this term is coming in third year, but I will just tell you what is hemodynamic monitoring. Hemodynamic monitoring means you are measuring the pressure, flow and oxygenation of the blood within the cardiovascular system, or it is measurement or interpretation of the biological system. Okay, so most of the time what why you are doing hemodynamic monitoring is maybe for early detection of complications or maybe for identification and treatment of life threatening conditions, or sometimes hemodynamic monitoring is done to evaluate the effectiveness of cardiovascular function. Okay, and most of the time this hemodynamic monitoring will help to assess if at all they are improving or not improving. And most of the patients who are with the myocardial infarction or heart failure, shock or hemorrhage with dehydration or GI bleeding, all these patients will be usually placed in a hemodynamic monitoring. In hemodynamic monitoring, we have got invasive as well as non-invasive methods also. Now, sometimes this non-invasive methods will include your cardiac monitoring or BP, you will be monitoring continuously of the patient and all. And these invasive methods will include arterial method of monitoring of BP, or you're placing the patient on IEBP monitor or CVP, that is central venous pressure monitoring. All that comes under your hemodynamic monitoring. Next is controlling of infection in ICU. That plays again a very important role, because when the patient is admitted in the intensive care unit, what happens is you have to do all the procedures in aseptic technique. Otherwise, the patient will tend to get cross infection or any nosocomial infection. So, follow a thorough hand hygiene or proper hand washing. You have to use personal protective equipments like gowning, mask, gloves, boots, and goggles also can be used whenever you are doing any procedures. And always try to follow a strict aseptic technique and always restrict the number of visitors, okay, to the hospital, and see that you are preventing any sorts of infection. It could be urinary tract infection or blood related type of infections also. So, in detail regarding infection control, we will be studying in the portion infection. Okay, and along with that, a nurse who is working in the ICU should have proper waste disposal method. Next is role of a nurse in the community. Now, in the community, they will have to work along with the family also, and you have to give care to each individual. You have to assess what is the problem with each individual, but along with that, you will have to prioritize what care is required, and along with that you may need to provide with nutritional support or diet. Then you can provide respiratory therapy, especially if there is a lot of secretions in the lungs. If they are dehydrated, you can provide IV therapy. If there are very poor people and if they need help, you can send them for community programs, or you can send them for some social programs, or you can ask the support of NGOs. Sometimes a patient may be bedridden. In that case, you may have to give physiotherapy or physical therapy. Then speech or language therapy also may be necessary. Next is family nursing. Now we are knowing what is family nursing or family healthcare nursing. So family nursing means you're providing care to the family. Okay, so that is referred as family nursing. Next one is what are the interventions of family care nursing? Now family care is related to experience with the family. Okay, and you may have to know what are the cultural factors which are influencing the family, or what is the community practices they do. All this has to be assessed before you are meeting the family, and you should know that first time when you go you may not be knowing much about the family, but as you are visiting the family you will come to know regarding each individual what is their problem, if they are having any illness or sickness, that you will assess. Or you can also find out what is the cause of the problem, whether it is physiological cause or whether it is psychologically related. So all this can be assessed in family care nursing, but most of the time you should remember that the nurse will strengthen each individual in the family. Next is principles of family nursing. So first of all, a family nursing is family oriented. It is not individually oriented, it is family oriented. So always consider the family as a whole, and along with that what you have to do is you have to provide with natural resources. The help should be provided with all the natural resources. See that you are having a good effective working relationship with the family. See that you are providing education to the family members, good supervision and guidance is there. You are connecting well with the community. You are able to supervise or guide each individual, and whatever care you have given you will have to record and report it. Okay, that is adequate documentation is very essential in family healthcare nursing. And finally you will have to evaluate the care. Now roles of family health nurse. Most of the time what happens is a family health nurse will have to assess each individual. After that they will have to plan. Okay, once they have planned they may have to aggregate the data or investigate on it, and they may have to perform diagnosis based on each person's family profile. Then after that what you have to do is, when you're preparing the plan of action you have to set up priorities. Okay, establish proper goals, set up priorities and implement this plan. So once the plan is implemented, you have documented it, you will have to review whether this entire process was very effective or not. If it was not effective, you can change your priorities or you can change your goals, and then you can provide care to the patient.